Some stuff that the President Biden administration, kind of the 11th hour, going to make some changes, all kinds of different programs. But today we're going to talk about particular changes that he's looking to make on Medicare. Some good, some bad. Depends on, I guess, your particular situation. And I guess we'll also see what the new administration, usually when a new administration comes in, they kind of reverse everything. So it really depends on how President Biden sets it up. All right. So if you're new to my channel, my name is Ed Weir. I ran the third business Social Security office in the country. And now in my semi-retirement, I make sure you all get everything you're entitled to if you're about to file. I've got over 800 videos. And then after I talk about the new proposals and the possibly the future of those proposals under the next administration, I am going to do a live Q&A. Looks like I already got a bunch of questions there, so you can ask any questions on all things Social Security, retirement, survivor benefits, Medicare, Medicaid, and all the rest of it. And I'll get to as many questions as I can in an hour. So if you're watching this on a recording later and you're like, oh my gosh, this guy spent an hour talking about Biden's proposals. No, I'll spend about 10 minutes. And then we'll get into your questions because there's always exceptions, the exceptions with all things Social Security. All right. So Biden and CMS, the Center for Medicare and Medicaid Services, proposed a bunch of rule changes. One of the things that really hit the news is this obesity medications and the fact that he's trying to get those covered under Medicare and Medicaid. So Medicare is what you sign up for at 65 years old, or if you're on disability after being on Social Security disability for 2 years, you get Medicare. Medicaid is a welfare-based health insurance from the state for low income, low resources. Right now is the big time up until December 7th for changing Medicare Advantage plan, Part D plans, and all the rest of it. It's a big time right now. There's a lot of changes for next year. If you want to review your plan, I've partnered with Chapter Medicare. You can give them a call and they can review your plan and see if there's anything better for you next year. They're licensed agents and throughout the country, and they can help you out completely free. All right, so looking to get these drugs covered under Medicare and or Medicaid. I thought it was kind of a typo when I saw the CMS communications that 42% of Americans are obese, but I double checked it, and yes, 42% of Americans are obese, and because of that, they have an increased risk for mortality, diabetes, cardiovascular disease, stroke, and all the rest of it. So these type of medications would save a lot of lives and also save Medicare and Medicaid, save the government a lot of money and therefore your taxpayers. And I'm sure you say, well, they'll just spend it someplace else. Well, that's a whole different video, I guess. So because of these major breakthroughs in anti-obesity medications, they're on the market. They were originally intended specifically for like diabetes, but you can get these medications if you have diabetes. You get your doctor's note and everything like that, prescription, and you can get it. But if you don't have, the full-blown diabetes, then you essentially can't get it, and they're going to expand that so you can get it without having, full-blown type 1 or type 2 diabetes or whatever the case may be, particularly type 2. But one of the problems is it's $1,000 a month for some of these, extremely expensive. So I guess they ran the numbers and they said, okay, yes, it's this amount that's kind of expensive, but we're spending this amount for all of the other ancillary type of conditions, cardiovascular and all the rest of the other health problems. So in the long run, it just might help people, make them healthier, live longer, and it just might save Medicare and Medicaid a whole bunch of money if we just go ahead and set it up and cover these type of obesity medications. Are you serious? All right. So hopefully I had volume there. All right. So hopefully they take care of these obesity medications and cover these through Medicare and Medicaid. So we will see what happens. These are proposals, and whether they continue these proposals, whether they're able to put them into full blown laws and regulations by the time Biden leaves office, we shall see. And then I guess we shall also see whether the next administration just completely reverses that. So we'll see what's happening. And I'm going to keep an eye on all this, as I do with all things Social Security, retirement, survivor benefits, spouse benefits, Medicare, Medicaid. I keep an eye on all this, and I bring all this information to you when it comes out. There's something you can use, and I teach you how to, all the tips, tricks, and secrets. All right. So another thing CMS and President Biden's administration is trying to do, they've been trying to do it for a while, trying to, kind of clamp down on these bad actors in terms of misleading advertising. I get on a daily basis, people come in on my live Q&A and say, hey, I just saw this. I just saw a grocery card that gives $3,000 a month for groceries. Is that legit? And I have to say, well, maybe, maybe not. What we see happening out there is a lot of these kind of bad actors take one car in the country and then they advertise it to every place in the country. And that is kind of a bait and switch type thing where they say they find some card in Tampa, Florida, and they say it's the really really good card. It gives grocery cards, electricity, over the counter type stuff, and then they advertise it to the entire country. And then you call them up and they say, well, unless you live in Tampa, Florida, you don't get it. But then they got you on the line and stuff. So it's kind of a bait and switch. So CMS has been trying to clamp down on that for a while. We'll see what happens with that. They also trying to, one of the things, Medicare brokers and agents, they're probably some of the toughest regulations in the country. They want to add on those. Sometimes, government bureaucracy regulations are good. Sometimes they reach a little bit too far. And in cases like this, they want the Medicare brokers to talk about the low income subsidy and Medicare savings program, which I talk about all the time on this particular channel. The low income subsidy is extra help with prescription drugs from the Social Security Administration. So it's a very, very easy form. So if you're having difficulty paying for your prescription drugs, please call Social Security. It's called extra help with prescription drugs, also called LIS, low income subsidy, and it might help you pay for your prescription drugs. Another thing is the Medicare savings program. If you or someone you know are having difficulty paying for your Part B premium, then you can contact Medicaid, your Department of Social Services in your particular state, and apply for Medicaid. And if you're approved, again, Medicaid is a low-income, low-resource program. If you're approved, then they will pay for your Part B premium. So next year it's going to be $185. So I talk about that a lot on this channel, trying to get people as much help as they possibly can that's out there. But I guess CMS is saying, hey, all Medicare people should talk about that when they enroll you and stuff. And that would make, if they're trying to find you the best Medicare Advantage plan or Medicare Supplement plan, that would make possibly all the stuff they want to add on there would make, your time with that person like 3 hours or 4 hours long. So I don't know. So some of it's a little bit overreach, if you ask me, but it's important information nonetheless. Another thing out there is clamping down on Medicare AI denials. There's certain companies out there that how it's supposed to happen on Medicare Advantage plan, not Medicare Supplements. Medicare Supplements, you don't have, to get approval from any company. If Medicare says you need it, and the doctor says you need it, that's medically necessary, you get covered. But with Medicare Advantage plans, that's one of the drawbacks is you have these prior authorizations that, the doctor has to confirm with the insurance company that it's going to be covered. And the insurance company is actually supposed to have a doctor look at it, but some have used artificial intelligence, and CMS is clamping down on that. the artificial intelligence and how many prior authorizations have been denied and all the rest of it. So we will see. And again, I'm going to keep an eye on all these little gory, nasty details, and we'll see what happens with the next administration. Dr. Oz is going to be in charge of all of this. He is going to be the next director of the Center for Medicare and Medicaid Services. So we will see what new regulations he comes up with or whether he deregulates. We shall see. And I'm going to keep an eye on all that, obviously. All right, so let's go ahead and move it into, make sure I got volume here. I got to get a new microphone. It keeps shutting out sometimes. So I'm not a professional YouTuber. I'm just, anyway, trying to help you all out. Okay, let's see. The U.S. needs to change our food processing methods to a much healthier one. Our environment and some of our food choices are making us sick and shortening our lifespan. Yeah, some of the stuff it's cheaper to put this additive in than this other additive, so they put this other additive in, which is actually bad for us and all the rest of it. I guess RFK is really focused on kind of artificial type of all that, but we will see and stuff like that. I'll keep an eye on that as well. Friend worked 20 years in the private sector, paid into Social Security. Then he became a teacher for a system that does not participate in Social Security. How can he figure the amount of WEP on his Social Security? Yeah, it's very difficult to do it kind of manually because first you have to know your AMI, the average index monthly earnings. Once you know that, then it's based on he'll get a WEP letter. We call it a WEP letter. It's basically a letter from that non-covered pension that says when you were first entitled, when you were first eligible, and how much the monthly benefit amount is. And then the benefit, that person's benefit amount will be recalculated. The windfall will be eliminated. Therefore, that is called a windfall elimination provision. All right. All right. A knowledgeable video. Thank you. Thank you. Do you include Medicare Part B premium for high income weight for extra help? Um, yeah, the for for Part B premium. So if you're paying a high premium on your Part B, you're not paying the regular $185. So the extra help, if you're talking about the extra help with prescription drugs, that's just for the prescription drugs part of it. It doesn't cover the Part B premium. The Part B premium, the only thing you can get to address that is Medicaid, and if you're yeah, or high wage earner, then you probably wouldn't be eligible for Medicaid. But yeah, the extra help does not help with Part B. It only helps with prescription drugs. Thanks, Ed. I told him that the company has him thinking he has a supplement that costs nothing. Oh, okay. Yeah, Jeffrey sent me an email and I responded to it there. Do you think the Biden proposal will get through? Don't know. Don't know. It has to. These are kind of the CMS is part of the kind of the executive, so they can make those. It's not necessarily a law; it's a regulation, but according it's a regulation kind of enacted by CMS under the direction of the executive. So it's not, didn't go through the whole, House of Representatives and Senate, all the rest of it. And based on the Chevron deference going away on the Supreme Court, all bets are off. Yeah. So we shall see. It's a brand new world, isn't it? Yeah. Because I do not want to waste my money on junk food and save my money. I now have too much in my account to become eligible for Medicaid. I am penalized because I saved my money. Yeah, and the numbers really haven't changed forever. It seems like in terms of your resources. Yeah. Let's see. I'm not into the anti-obesity meds. They can be dangerous. So I lost 38 pounds on my own, but I'm creeping up again. Got to go back on the intermittent fasting and healthier foods. Yeah, I did that intermittent fasting a couple of years ago. I lost like 20 pounds. That was keto and intermittent fasting. $10 Jeff, thank you. Appreciate it. You are too awesome. Thank you for the support. Let's see here. Skipping around a little bit. Got a lot of questions. Applied 2 weeks ago for benefits to start January. Agent said that I would get X and it would increase with COLA since I wasn't already on benefits. Yeah, COLA. People always have questions about COLA. Did I get it? Did I not get it? If you didn't get it, then that is like super, super. That is 0.0000001%. I've never seen it happen because when COLA comes out and it's decided how much COLA is going to be, the Social Security computer people just go into the Social Security system and they multiply everybody's benefits by 2.5%. So yeah, everybody gets the COLA at the same time. Can my kids' benefits be affected since I will be collecting my Social Security and they are both 18 if we move overseas? No, no. Well, if they're U.S. citizens, no. If they're not U.S. citizens, then there is a great um, let's see. There is a great website that Social Security has. It's a little tool that you can go in there, and it's called the Payments Abroad Screening Tool. So if your children are not U.S. citizens, you go in there, and it'll tell you whether your children can get benefits overseas. But yeah, once they have 18, then their benefits are going to stop, unless they're in high school. I got denial letter disability. Got lawyer he filled for got lawyer he filled for reconsideration of benefits. How long? Chances? It's you'll get the decision about the same amount of time it took the initial decision. So it really depends on your disability. I believe it's a great thing to cover obesity medications. I am not obese. I do know a lot of people who are. They have so many medical issues. Yeah. So yeah, even whatever your personal philosophy is on that issue, it sounds as though it's going to save the Medicare and everything taxpayer a lot of money. So, and hopefully they can negotiate. That's part of the Inflation Reduction Act under Biden, was enabling Medicare to now negotiate prices of medications. That's why people that have the VA use the VA medical system. If they get a Medicare Advantage plan, quite often they get one with a Medicare Advantage plan with just medical. They get one without the prescription drugs. Most Medicare Advantage plans have prescription, the Part D plan included in there, but veterans that predominantly use the VA get one without the prescription drugs because they don't need it, because the VA has really, really good prices on medications because they're able to negotiate. So one arm of the government is able to negotiate pharmaceutical prices, and Medicare hasn't been able to since for decades. So yes. An ad just popped up regarding the 1200 benefits card. I haven't found anyone in the community where I live. Majority of us are on Medicare, Medicaid. Too many scammers. Yeah, I can't control what YouTube decides to pop up there, but yeah, that's the kind of thing I was talking about. So I bet you, yeah. So you already know. So something flashed across. I apologize. I don't have control over that. The ad popped up and says, "Hey, click this button. You get $1,200 for this, and free ice cream and unicorns, and it's awesome. Call us up." And then you call them up, and they say, "Well, do you live in this particular zip code in West Virginia?" "No, I don't." "Well, sorry, you can't get that. But since I got you on the line, and I've got your phone number, and I'm going to be harassing you till the end of time, and I'm going to sell your number to everybody and their brother in the country," and that's where you get all those Medicare annoying calls. And Center for Medicare and Medicaid Services also clamping down on that. Starting October 1st, they joined with the FTC, the Federal Trade Commission, the FCC, Federal Communications Commission, and they kind of joined together and said, "Hey, we got to stop all these harassing, scamming, calls, annoying calls." And the other two, FTC and FCC, says, "Okay, yeah, we'll do it essentially starting next year, March or something." And Medicare said, "No, we can't wait till March. Our season starts October 15th. We want to stop those calls." So starting October 1st, say, for instance, if you call me, and if I'm a Medicare insurance broker, I don't enroll people in Medicare. But if you called me and I try to sell you a Medicare plan and a Medicare Advantage, Medicare Supplement, Part D, whatever, and then you say, "Oh, no, I'm good. I'm actually going to be moving overseas, so I really don't need it." Well, then I'm like, "Oh, I paid $35 for Facebook for that advertisement, and I just lost $35 on this person." So I'll sell the phone number to everybody in the country for like $1 and stuff. So that's basically, I don't do that. I don't do that. And Chapter doesn't do that. Basically, if people, here's how stringent we are. I get emails all the time says, yeah, oh yeah, thanks for helping. Can you call my brother? No, sorry, no, sorry, no. About Medicare. Can you call my brother about Medicare? He needs help with Medicare. No, he has to call us. If he doesn't call Chapter there, then Chapter's not going to call him. If you say, hey, call my brother down the street, no, he has to call us first. So that's how it goes. We don't do any, outdoing. That's why I picked Chapter, because they're really, really good at, being above board like that. So how many times can I switch insurance companies for an Advantage plan? I keep getting conflicting information as far as benefits. I hate to tell you news, but you can switch every single day until December 7th. Please don't. But yeah, sometimes, you get one of those annoying calls, those cold calls, and you just think it's a friend and you pick it up and they convince you to switch your plan. You're like, oh, wow, I shouldn't have done that. No problem. You have until December 7th. Whatever plan you have on December 7th, the last plan you chose, that's the one that goes effect on January 1st. So, yep, you still have time. Let's see here. Why can I not add the chat? I did a little delay. We're getting a lot of political type stuff, so I kind of delayed the chat. I figured I'd try it one time, but if it doesn't work, I'll switch back to the other one. So, but you can add the chat because you were just there. So, dual eligible, they call it. Yeah, a dual eligible. We'll see what happens with that, because the next President-elect Trump, and his previous administration, that's one of the focuses, try to cut back on Medicaid and SSI, the supplemental security income, the welfare-based program Social Security administers, and so dual eligible. We'll see what happens with the next administration. I try to stay apolitical. My job is to help y'all get the benefits. I don't care what your philosophy is. It's kind of like a doctor or nurse. You come in there and, give you your shot. Don't care how you voted. So with the dual eligible, basically the dual means you're on Medicare and Medicaid. So if you're on Medicare and Medicaid, and there's have to be a upper level, there's still several different levels of Medicaid depending on your situation and the state and everything. But if you're on Medicare and Medicaid, you're also eligible for a Medicare Advantage dual eligible plan. And those are the ones predominantly that have all of those crazy cards. The one you just saw probably that popped up that says you get $1,200 for whatever. That's probably tied to a Medicare Advantage dual eligible plan, because those are the ones that have the most in terms of those not gift cards, or grocery cards and all the rest of it. But it really depends on your particular area. So, reach out to, go to Medicare, reach out to your insurance broker, agent, someone you know and trust, or you can definitely reach out to Chapter, and they can see if there's anything available in your particular neck of the woods. Who used to say that? The original Ronald McDonald's. I forget what his name was, but asking for someone, a disabled adult child. Number one, thank you for looking out for other people. She's switching from SSI to SSDI. Okay. SSI, where a $2,000 bank account limit typically applies. How about SSDI? Does she need to keep the balance under $2,000? Mahalo. I'll give you a Kamaina discount on this one. It's going to be a free answer. I lived in Hawaii. I was stationed at Camp Smith in Kaneohe Bay for 4 years total. But okay, so yes, she sounds like she's doing the right thing. She was receiving SSI, supplemental security income, the welfare-based program based on a disability. One of her parents either retired, got on disability, or passed. And so she became disabled before the age of 22. So she's applying for disabled adult child benefits, which switches her from SSI to SSDI, Social Security Disability Insurance. She's doing everything 100% right. And now doesn't matter how much she has in the bank. No, SSDI is not an income or resource limited program. She can have $1 billion in the bank and it doesn't affect the SSDI at all, unless she worked for that $1 billion. because SSDI is still disability, and Social Security defines disability as inability to work. So if she's working, he or she's working, then she's working, then she wouldn't get SSDI. But if she was receiving SSI, she was also probably receiving some type of assistance from the state, Medicaid perhaps, and that's a whole different ball of wax. So have to contact the state Medicaid, and when she gets that conversion to SSDI and gets more money, make sure she contacts the state if she's getting any state type of benefits. Okay. Is there a formula we can use to verify we're being paid the correct amount of our regular Social Security benefits? My salaries seem to be correctly reported to Social Security. It's you take your average index monthly earnings, and if it's a recent one, you don't have to index it because it's basically face value. If you made 20,000, it's 20,000. Unlike if you made 20,000 in 1975. They index it for today's numbers, so it's like probably $80,000 or $100,000 now. So you take that and you multiply it by a first bucket of money by 90%, the second bucket of money by 32%, and the third bucket of money by 15%, and you come up with your primary insurance amount. But you can also, if you don't want to do the long division, you go into SSA.gov, My Social Security, and just put in that number manually, and it'll give you that number. Yep. Filtering the background noise will make it much easier for legitimate questions to show up in the chat. I feel so bad for people who really need help but end up drowned by nonsense. Oh, okay. Okay. So, all right. So thank you for that feedback. I'm always trying to make everything a little bit better here. I worked as a nurse and took care of my 4 children. They took me that with me working on and off the last 10 years. Better hurt me because I was disabled and didn't make much money. I decided to apply. Okay, not sure. So, in order to get disability, so you're talking about 10 years and stuff and working and not working. In order to get disability, you have to meet 2 insurance statuses. You have to be insured. That is, mostly you paid into the system for 10 years, 40 quarters. So you're insured. But for disability, you also have to be currently insured. So you had to work 5 out of the last 10 years. And the idea is, let's say you worked in your 20s and 30s, and you got your 10 years, you got your 40 quarters, so you're insured for disability and retirement, all that kind of good stuff. But then you take off for the next 30 years, and now you're 50 years old, and you want to file for disability because you hurt yourself jumping off a cliff diving in Acapulco. Yes. And you say, I can't work because now I'm injured. I'm disabled, and Social Security. Well, you really haven't worked. You haven't been working for decades. So you have to be currently insured. That means you had to pay into 5 out of the last 10 years. So you had to be working 5 out of the last 10 years, not consecutive or anything, but any 5 out of the last 10 years. So possibly that's what you're talking about. So let's see here. I'm jumping around a little bit. My husband passed. We were both disabled. They said I still am unable to receive Medicare until I am 65. That is correct. Wait a second. But you're still disabled, even though I was deemed as disabled and I receive widow's benefits. Yeah, that doesn't make sense. If you were receiving widow's disability, that is disabled widow's benefits from. You can get disabled widow's benefits on another person's record as a widow from 50 to 59. So if you're receiving disabled widow's benefits based on obviously a disability, then you should get Medicare within the 24 months. So yeah, that doesn't sound right if you were deemed disabled by the Social Security Administration, unless your disability was just SSI. You were just getting SSI disability. There is no Medicare for just straight SSI disability. So there is possibly you fall within this. You were not insured for regular disability. You're insured for retirement eventually, or Medicare at 65, but you weren't insured for SSDI disability. And you cannot get Medicare based on SSI. It has to be SSDI. So that's probably your situation. So, but yeah, if you're approaching 65, you need to go ahead and sign up for Part A, Part B of Medicare. And then you'll probably need help with, figuring out how to cover all those gaps. And chapter can give them a call and they can help you out. If I was dropped from Medicaid due to making too much on survivor benefits I claim now, do I qualify for a supplement without the medical underwriting? I was previously on a dual. It depends on your particular state. Usually not if you lost a dual, because you're right now there's close to 1.8 million people have had their Medicare Advantage and Part D plans canceled. And because they were canceled, they have what's called a guarantee issue right to get either an F plan or a G plan without any health underwriting. So if you need any help with that, go through Medicare, your insurance agent, or you can call Chapter and they can help you out. But you weren't canceled from Medicare, you just lost your Medicaid. So that's not going to give you a guaranteed issue right to where you don't have to go through the health underwriting. But it really depends on your particular state. Those particular type of issues also, if you're in New York, you pretty much do it anytime. Connecticut and stuff like that. And there's birthday rules. So if you want help, reach out to your agent or whoever who helps you out, or you can reach out to Chapter and they can help you out as well. But one thing I know for sure is if you've lost Medicaid, then yes, you lost your dual. So that plan, you no longer have that plan. So you definitely have to find another plan, whether it's a Medicare Advantage plan or a Medicare Supplement plan. As you know, if you watch this channel, I always recommend Medicare Supplement plans first, a Plan N, then a Plan G. But if it just doesn't work for you, usually it's a budget type issue, then Medicare Advantage is your next option. How can I show SSA that my income for 2024 is greatly reduced from my income in 2023? I need to have my Medicare deduction from my monthly benefits adjusted. So that's an SSA 44. So it sounds like you have a life-changing event. You're being charged the IRMAA, the income-related monthly adjustment amount, the extra Part B premium. And it was based on 2 years ago. 2022, or actually if it's anyway. But yeah, if you have a life-changing event that you stopped working, got divorced, reduced your hours, whatever the case may be, then you file an SSA 44 and tell them about the life-changing event, and they will readjust your Medicare Part B premium, and you will no longer have to pay more than most people, $185 for next year. No one has received a benefits card that I know of. My dual complete through yada yada offered a $220 benefit card, which is paying $3 less in 2025. Grocery prices are still going up. Nobody has received a benefits card that I know of, but then you just said there is one. So I'm not sure what that means. But yeah, a lot of the plans are, if you look at the details because of the Inflation Reduction Act and the Part D and medical, inflation and all the rest of it, a lot of those Medicare Advantage Part D plans are kind of, depending on your particular area, the price, the coverage is being reduced pretty much, and like I said, some are being canceled throughout the country. So if you never reviewed your Medicare Advantage plan or Part D plan, then this is definitely the year to do it. You should do it really kind of every year, but so reach out to the person that enrolled you. Go to Medicare.gov, or you can reach out to Chapter, and they can help you see what's available in your area. And some of the people they help, they say, oh yeah, you're in a good plan. You're good. See you next year. Call us up next year. All right. Oh, Boomer Tuber. Hey, Boomer Tuber. Thank you for the support. I appreciate it. I turned 65 in January. Do I need to sign up for Medicare by December 7th? Can I just walk into Social Security office to sign up for Medicare? Okay. For your particular case, the December 7th thing is not relevant. That's only for people that currently have, plans that they want to switch. For you can do it anytime. So I wouldn't recommend, if you want to use any company, particularly if you want to use Chapter, give them a call, but don't give them a call till like December 9th. Because they're crazy with the AEP, the annual enrollment period that's going on right now. So if you want to use them or anybody, wait till December 9th. And for the Medicare plan, for the Medicare Supplement, Medicare Advantage, Part D, and all that kind of stuff. But in terms of signing up for Medicare itself, can you just walk into Social Security? Well, they just changed the regulations. They finally pulled the trigger, and they said you have to have an appointment. And but that's a bad decision if you ask me. But I would still get an appointment, or you can go ahead and go online and SSA.gov and sign up for Medicare. That is if you're not receiving Social Security benefits. It sounds like you're not receiving Social Security benefits. If you have been receiving Social Security benefits, then you should have already received your Medicare card, your A and B and all that stuff. So for you, go ahead. You can go ahead and sign up for Medicare Part A and Part B if that's what you want to do on SSA.gov, or call and schedule an appointment. And while you're waiting for that, then start investigating what you want to do for a supplement or an advantage plan. So. Why are people getting SSI? They are not even citizens. Well, people that are in the country legally, if they're citizens or not, are still eligible. So if you're in the country legally, you can get Social Security retirement benefits, disability benefits, survivor benefits, SSI. It's not just for U.S. citizens. 63, drawing SSI and working. SSI, the welfare-based program? No. If you're making $24,000, you're not receiving SSI. You probably mean just regular retirement. Okay. I earn just around $24,000 a year, but all is earned in 9 months. Winter's off. Do I need to monthly report earnings, keep each month lower, or is it average annual? It is averaged annually. Whatever your buddies at the IRS tell Social Security next year, then that's going to be the deal. But if you might be a little bit over. This year is 22,000 or so. So you might be a little bit over if you're making 24,000, because they go by the year. So you can make $24,000 in January and then take off for the other 11 months. But Social Security looks at the whole year. The first year you start collecting, then they look at the monthly. But it sounds like you've been collecting for a little bit. So let's see. Can MA plans be age limited for those on SSDI but not dual eligible? No, there's no limits on Medicare Advantage. You can get it if you're on disability at, Social Security disability at, starting 18 years old. And then you get your Medicare at 20. You can get Medicare Advantage at 20 or 120. I was denied application to a plan because I was under age 65, not specified on the government website on A and B. So you were denied for a Medicare supplement plan, not a Medicare Advantage, not an MA plan. You were denied for a Medicare supplement plan, that is definitely a thing. It's 100% based on your state. In some states like New York and stuff, if you're under 65, you can still get a Medicare supplement plan, but very expensive. In some states, you can get it, and it's very expensive. In some states, you just can't get it. But when you turn 65, they can't deny you for a Medicare supplement. So what people do is they go ahead and get a Medicare Advantage plan when they're under 65 on Medicare, because in their state, that's all they can get. And then when they turn 65, then they check a Medicare supplement plan, see if it's right for them, and they cannot be denied, and you don't have to go through health underwriting. So that is definitely one thing to check out. It does cost a monthly premium, but a lot of people really, really are happy that they switched, but it really depends on each particular situation. Is there a website available that compares the Advantage plans available? Yeah, Medicare.gov. You can definitely wade through there and see. Sometimes, that's one of the things that CMS is making these companies kind of update that website a little bit better. That's one of their proposals. Medicare insurance agents and brokers have access to other systems as well. So if you want, you can reach out to chapter. They can, again, it's completely free. People always say, well, instead of rather going through an insurance broker or agent or whoever, I'll just go directly to the company. I'll save money. No, it's exactly the same price. It's just that, whatever commissions the insurance agent or broker makes to support their family, now that particular insurance company keeps it. So the CEO can buy another yacht. So I will take my regular Social Security at 65. I plan to move to Missouri. Will my benefit payment stay the same? Yes, 100%. Yep. So regular Social Security benefits are the same. Doesn't matter where you are in the world. In terms of Medicare, same thing. Medicare Part A and Part B, same. Doesn't matter where you are. The Medicare Supplement plan and Medicare Advantage plan, Part D plans, those are area state specific. So you'll probably have to switch those. And there was one big company that just left Missouri, just said everybody in Missouri that has our plan, bye. So you probably receive letters if you're living in Missouri about that plan leaving the state. Just Jeff. Hey, just Jeff. Hadn't seen you in a while. Hope you and your community had a great Thanksgiving. Hit those likes. Yes, please. Yes, hit those likes. I appreciate it. I would like to thank you all for your great informative information. You're welcome. Thank you. Oh, it looks like, yes, mine is an Advantage dual eligible due to my severe vision impairment and treatment. That's why I have the plan. Yes, so dual eligible. So you have Medicare Advantage, or you have a Medicaid and Medicare. Let's see. The company I work for filed for my SSDI, but didn't add or file for the $300 for being a veteran. Can I still go to Social Security and have them add that small benefit? Yes, absolutely. Yep. Just call Social Security. Maybe they add it, maybe they didn't. Sometimes the Social Security system interfaces with the VA and it immediately pops up. I try to figure out, there was no rhyme or reason when it popped up. It was strange. But sometimes it popped up automatically. But if it didn't, it's hard to tell. It's impossible to know on the outside. So yeah, call them up and say, hey, was my veteran thing included in there? And if it wasn't, just send them a copy of DD-214. I have Dual Complete. It pays for my Medicare premium, zero copay on everything across the board. Doctor, scripts, hospital, executive, plus a $250 per month OTC. Yeah, those Medicare supplement plans, you $250, you live in a pretty good area that has good, the Medicare Advantage dual eligible program. So perfect. I called chapter today, and they were excellent and very patient with me and answered all my questions. Thanks for all your help. Awesome. Okay, good deal. Another positive response. All right. I'm keeping an eye on them, but they're doing an awesome job so far. I have been on SSI for the last 20 years. I have Medicaid. Can I get Medicare? Just turned 63. If you're only on SSI, then no. If you are eligible for Medicare at 65 based on, prior work or something, or then you would be able to get Medicare at 65. Yes. But sometimes, as I just talked about, you can get, SSI, even though you were eligible for SSDI, but because you didn't pay into it recently, you're not eligible, but you're still insured. So yeah, it's crazy complicated. So anyway, yes. Or sometimes the states, in order to save themselves money, sometimes, depending on your particular state, the Medicaid might say, you know what, we'll go ahead and sign you up for Medicare early if you're eligible for Medicare based on whatever, and they'll pay for whatever it is. So I collect IEDS benefits. One of your videos say we should call Social Security every 6 months, 1 year to ask if we can make a survivor claim. Why doesn't Social Security let us know they passed? Do we lose dollars until we find out? No, for you're good because you're already, IEDS is independently entitled divorced spouse benefits. So that person filed for benefits on an ex-spouse, even though the ex-spouse wasn't receiving benefits. So pleasure mix, good job in knowing that. A lot of people are missing those benefits and losing a lot of money. So you did the right thing there. But what I meant was if yours will automatically switch. So if your ex-spouse passes away, your benefits will automatically be increased, double, probably. But if you have someone that is not receiving benefits on that record, and unless you keep in touch with them, you don't know. So if you don't know the whereabouts or anything about that person, and you don't know if they're alive or dead or on Mars or whatever the case may be, then that's what I meant, is to call up, every now and then, say, hey, I want to file a survivor claim, and then, yeah, can't do it. Why not? Because the person's still alive and kicking. But in your case, as soon as that person passes away, then your benefits will increase automatically, and that's how you will know whether that person is kicking or screaming. I will be turning 65 soon and receiving SSDI. However, I have worked for a few years. My question is whether I will have an increase of changing to Social Security. Yeah, if that's one of your high 35 years, you're getting the increase now. So nothing will change once you switch to 65 or anything. The only difference in 65 is now you're able to get a Medicare supplement plan. Everything else stays the same. When you turn your full retirement age, 66 and 8 months or 67 or whatever the case may be, and you're switched from disability to retirement benefits, that's next change. But your check will stay the same. Most people don't even notice the switch. But yeah, and if you're on retirement benefits or disability benefits, if you work and pay more into Social Security, and that's one of your high 35 years of earnings, the benefits are recalculated every year automatically, 100%. I have Medicare and medical. I didn't join insurance companies. City of Hope accept it. I don't have any problems with my treatment. All right. So yeah, if you're good, you're good, you're good. So you have Medicare and Medi-Cal. Sounds like, yeah, the state of California, they always want to do something, different. And instead of calling it Medicaid, like most places in the country, they decided to call it Medi-Cal. And now it just looks like medical. So yeah. Let's see. Al Roker in your neck of the woods. I think it was the other guy before Al Roker, I think, used to say it. The original, Ronald McDonald. Is it true that the December 7th deadline date got moved because of the hurricane to December 31st? They usually have kind of a kind of a special enrollment period all year long for particular things like that. So if you have some type of natural disaster, and it's amazing what they categorize as a natural disaster. If it rains, if it snows like half an inch in Vegas, which it did a few years ago, that might be a natural disaster. And so they said, hey, because it snowed on December 7th in Vegas, we're going to consider it a natural disaster. So if you weren't able to switch your Medicare Advantage plan that day, you have another special enrollment period. So yeah, that happens all the time. So you are fantastic. Thank you. I sent your podcast to my dad, sister, and brother who are turning 65 this year. Awesome. I appreciate it. Sissy in Florida. All right. I grew up in Florida, Bradenton and Homestead, before it was, speaking of a hurricane, before it was completely destroyed by Hurricane Andrew. So when I switch insurance companies, do I have to cancel the previous one, or does it automatically cancel when I switch? If you're talking about Medicare Advantage type stuff, Part D plan, it automatically. So you get to your new plan, and then then it automatically switches. What happens is you sign up with your broker or chapter, whoever, and they send it to Medicare, and Medicare looks at it, and then I think they just kind of hold off on it because you might change your mind. But I'm not sure how the internal computer system at Medicare does it. But once that's your final decision, then it notifies the other place that you've been canceled, you've been fired, and then they send you your new information, and your new one starts January 1st. It's a little bit different with like a Medicare supplement plan. It's partly automatic, but on that I would definitely contact them, your Medicare supplement if you switch to a Medicare Advantage. So let's see, asking for someone DAC follow-up. Okay, she said yes, she is receiving Medicare with the help of Medicaid. So does she need to keep her bank balance under 2,000? So that's state Medicaid. And so I would reach out to them. But yeah, there is almost in every state, because Medicaid is a welfare-based program, low income, low resources. I would definitely check out with them on how much she's allowed to do. And I would also possibly, depending on her age, check out like an ABLE account, ABLE, ABLE. I'm not sure how old she is, and they just changed the age you can get an ABLE account. So an ABLE account is if you're on disability, a means tested program, and you're not allowed to have any money in the bank, you can set up this ABLE account, and which is really good because some people says, well, I'm in a wheelchair and I need to sign up. I need to save up for a van, but because I can't, have more than $2,000 in the bank, I will never be able to get a, wheelchair accessible van. So this is killing me. So with an ABLE account, you can put all that money that you get from, friends and family or donations or working or saving. You can put that in that ABLE account to be used for a specific situation like that. So you can, get yourself a van. So I think that's a great thing they came up with a few years ago. The ABLE account, ABLE. Why does the SSA penalize spouse survivor benefits by reducing them when the surviving spouse is under 60? The only time they give benefits is when there is a child under 16. Yeah, they do that to everybody. Anytime you take money from Social Security for retirement benefits, survivor benefits, spouse benefits, you take the money early, then it's reduced. Penalty, you can call it a penalty, but there's just a reduction. So if everybody got the full amount at day one, then the trust fund would run out in an hour. So if you're collecting regular Social Security at age 65 and have an online business, does the 23,000 income still rule apply? Yes. If you're receiving just regular retirement, benefits, you're limited to the amount of income. But it really depends on whether that online business is, how you categorize that as net income from a business. If it's net income from a business, then yes. But remember, you have expenses and all that kind of good stuff. So if you're, it really depends how you notify the IRS, because the IRS notifies Social Security and says, hey, this person made, $400,000 selling, whatever on eBay. Then that's going to be over. Let's see. Jumping around a little bit. I'm in Oklahoma. I have company Advantage. It does pay for the drug, the obesity drug only, but no one has it. Every pharmacy I call doesn't have it, and no idea when, if they will get it. Wow. First time I heard that. So I guess they're, selling it and they can't keep up with demand. So thanks. You were so helpful on everything Social Security related. Yeah, I appreciate it. Thank you. A particular company just sent a letter. They are dropping the $275 over-the-counter MasterCard extra help. Yeah. So again, that's kind of happening throughout the country. They're downgrading benefits. And health insurance companies are very smart. That's how they became billion-dollar health insurance companies. They know 70% of people don't even check their plans. Again, Medicare Advantage, Part D plans, people, they just say, hey, the plan I have is still zero premium, and I think I kind of still have the same doctor, and it was good to me this year, and so I guess, all right, I don't have an hour to spare to call my broker or chapter or whoever to do a little research, and so 70% of people just don't do anything, and insurance companies love that because that means they can do anything they want to with the details. They keep it at zero premium, but then they jack it up. Instead of $100 a day at a hospital, it's $500. Instead of $50 for a CT scan, it's $150. And so that's how they get their money. Does chapter only deal with X company? They deal with pretty much every company. Yeah, they pretty much they deal, even if there is some. They definitely deal with that one, and they deal with all the big national ones. But there's so many local companies, like, in kind of West Texas, there might be some local physicians that has a Medicare Advantage plan. And, they might have an agent, a broker that deals with that particular company. But it doesn't matter. That's why I like chapter, is because it doesn't matter to them. If they look at it and they say, wow, we don't have a contract with that physician's Medicare Advantage company in West Texas, but that's definitely the best plan for you. They will help you enroll in it. And they say, oh yeah, that's the best plan. It's got the best, it's got the doctors you want. It's got the cheapest prices for prescriptions. It's got the gym memberships. It's got whatever it's got. And they say that's the best one. And they say, yeah, here's the phone number, or we can enroll you. And even though, they don't contract with that particular company. So that's one of the reasons I chose them. Why does Social Security deny spouse survivor benefits when spouse is under 60, but FERS survivor pension? Yeah, so that's FERS. That's a completely different system. Why do some people have hair and I don't? Let's see here. David, start benefits in 2025. First check February. Annual earnings or monthly? Both. It's your first year, but your first year started in January, so it's the annual. Yeah, so there is no monthly because there is no month in 2025 before January. So I have Medicare and medical, but I didn't. Okay, I already answered that one. I got an N supplement for $84 a month. Awesome. Good deal. Yes, that's why I like the N's, because they're cheaper and than a G. And those N's, as far as everybody thinks in the industry, the N prices will increase slower than the G going forward. So I think you're going to even save even more money in the future. That's why I like N. A lot of people don't, because it's a little bit more difficult to explain, but I'm sure they explain it to you, about, there's got a couple little small charges that you may or might not incur. People like G because it's easy to understand, but it costs a little bit more, and I'm cheap like that. So, Dr. Oggs has no business on any of the team. He is a big pharma sellout. Has been okay. All right, yeah, that's. We'll see what's going on in the future. I'm old Marine Corps sergeant, very optimistic, hopeful, and if it's like a broken clock. Oh, I hate this person, but wow, he was right twice a day, and I got a broken clock. So maybe you never know. We'll keep our fingers crossed here. Am 67 on psych meds for 45 years. Lost my 943 in April. Now today was last fill for meds after lost Medicaid. Can I draw off my partner's Social Security who died a year ago tomorrow? We were together 23. Yes. So it sounds like you lost the SSI, because $943 is how much SSI is for this year. But yes, maybe that's why they kicked you off SSI, because you were supposed to file for survivor benefits. You were supposed to file for them maybe at 60. That's the earliest you can get survivor benefits. So maybe just partner just passed. Well, he died a year ago. Okay. So yeah. So as of last year when he passed away, that's probably why they kicked you off SSI, because there's more money on survivor benefits and you had to file for those benefits. So if you haven't filed for those benefits, file for them and ask them to give you back pay and say, okay, for whatever reason, I didn't file when I was supposed to a year ago, but I was on SSI and this, that, the other. See if they'll give you that year of back pay. So that'll definitely help out. Can you claim on more than one husband at a time? One passed 7 years ago and one divorced, married 11 years. Not really. No, not at the same time. You get the higher the benefit. Whichever one's the higher, that's the one you go for. What the person was asking is, an Advantage plan helps cover part of the monthly premium. Are we taxed on the money that the company pays to Medicare? No, I've never seen them send a 1099 for something like that. No. I've been hearing the word chapter. What is chapter? Thanks for all you do. That's chapter right there. Right there. That is my partner that helps with all things Medicare. So they help you find a Medicare Advantage plan, a prescription drug plan, a Medicare supplement plan. And so just call them up. And if you need help looking for all of those, and they can help you out. Thank you for taking your time to answer your questions. You're welcome. Let's see. Since Dr. Oz is appointed and not elected, what is the best action to take to influence policy to maintain Social Security solvency? Yeah, he's Medicare, so for solvency, yeah, the commissioner hasn't been chosen yet. I'd be interested to see who the next commissioner of Social Security is. But yeah, always, always, always. If I've talked about the different methods to shore up Social Security going forward, reach out to your politicians, reach out to your congressional, the House representatives, whatever district you're in, reach out to your state, your federal two senators from each state, reach out to those two individuals, send a letter to the White House. Yes, get active. And Social Security long-term solvency can be fixed in like 10 minutes. It's so crazy easy to fix it. It's just smash the cap, have everybody pay the same amount of FICA as 99%. So yeah. How do I get the N supplement insurance? I need a supplement insurance to go with my original Medicare. Yeah, reach out to your insurance agent, broker, someone you know, or call Chapter, and they can help you out. And with the supplement, it depends on your age and your particular situation. You may or may have to go through medical underwriting. But yeah, it's always good to check out to see if a supplement. I always say, go down the list. Okay, let's check Plan N. Oh, okay, that's not for me. Plan G. Yeah. Let's see what's next. Medicare Advantage. You check Medicare Advantage. Oh, okay, I guess Plan G was the best, right? So you always go down the list, or you can start at the bottom and go up. Whichever you want, I guess. Yeah. Do I have to cancel my previous insurance Advantage plan I got, or will the new insurance company cancel? Yeah, for a Medicare Advantage type, it'll automatically cancel out. So if you signed up for a Medicare Advantage plan yesterday and then signed up for another one today, then you don't have to do anything. The new one you signed up, the new application you put in today will cancel out the one you put in yesterday. So, all right, we are over an hour, and let me do one more. What hours can I call for help from Chapter Free Medicare Help? Yeah, they're gonna be crazy hours. I did 7 o'clock in the morning. I'm not sure exactly what the hours are, but this is like the last week or so. And December 7th is the end, and then they're all going to sleep for 24 hours. But yeah, pretty much, they've got agents, brokers. They got brokers all over the country. So you can give them a shot at 7 o'clock in the morning. I bet you somebody will pick up. It's at 8 o'clock, and yeah, they're going to be working late. So because this is the craziest Medicare season we've had forever. All right, let's see here. Did I understand you correctly? If I turn 65, supplement plans have to accept me even with pre-existing conditions? Yes. Is that awesome? So if you're on disability, here's things you have to do. When you're 60 years old, check to see if you're entitled to any survivor benefits, because you can get disability and continue your Medicare and get survivor benefits if there's more money there. At 62, see if you're entitled to any spouse benefits, current spouse, divorced spouse benefits. At 65, check to see if a Medicare supplement plan is right for you. And then at your full retirement age, you're no longer on disability. You can work. No more continuing disability reviews. You're free. Do whatever you want. So Social Security doesn't care. All right. That is it. I apologize. I didn't have time for all the questions.